Hello and welcome back to 5 Minute Sickle Cell Lessons. My name is Marissa Kors. I am your fifth generation sickle cell patient, advocate, activist, and educator. Um, it's been a while since I've done one of these videos. I took some time off and now I'm back. And today we are talking about Benadryl. Yes, Benadryl. Uh, Benadryl is a very controversial medication when it comes to sickle cell care, mainly just due to discrimination against us as a patient group, mostly. And we're going to get into that. But first, we're going to talk about what Benadryl actually is. Okay. So, Benadryl diphenhydramine, I think I said that right, is an antihistamine. And it relieves pain, and itching, uh, from a number of things: cuts, burns, poison ivy, poison oak, poison sumac, when applied topically. So it comes in three forms: topical, oral, and IV. Okay. Um, it can, in its oral form, it can treat fever, allergies, cold symptoms, and insomnia. Even in its injected form, it can treat severe allergic reaction, motion sickness, and symptoms of Parkinson's disease. Who knew? Okay. So basically, it is your basic over-the-counter stop me from itching, sneezing, let me get a little bit of rest medication. It is also generally the active ingredient in your nighttime cold medications. When you flip over the box and you read um, what makes it nighttime or good sleep or whatever, is generally just there's Benadryl in it. Alrighty. So when we talk about Benadryl with sickle cell patients, Benadryl, IV Benadryl, is used when giving IV pain medications, IV opioids, because morphine, Dilaudid, fentanyl, they are all opioids and they are incredibly itchy, especially when they're given via IV. It doesn't matter if it's a PCA, if the medication is pushed. That is the reaction that one is going to get almost every time from these medications. And so, therefore, IV Benadryl is given to counter the itchiness, the burning in your veins, the hives that often will appear, especially if the IV is old. And let me tell you, IV Benadryl is no joke. I often call it Drano for the veins because it burns that much and that hot. And just to give you an idea, this is a picture of my leg from my last hospitalization. And, ooh, did not mean to do that. If you look closely, you see red blotches here, just all up and around. You see those red blotches? That is Benadryl. So this picture was taken right after my Benadryl had been given to me. And the reason that I take the pictures is because oftentimes our nurses and doctors are not taught to see the reactions that our medications cause on dark skin. So they just think it's part of your beautiful bronze complexion, when really, no, this is your body reacting not only to your pain medication, but to the Benadryl. I like to call it the light show. And when you have a new IV or a really good IV, you can feel where that Benadryl and that medication, pain medication, is going through your body. You literally can trace it. One, because it's just burning, going in every odd direction. But two, because the pathway that it's taking will come up red and it will light up, especially on a peripheral IV that's close to the surface. You get a very cool light show map of where your Benadryl is going and what it's doing. Unfortunately, though, if we don't um, push Benadryl after it is pushed into the IV, so a lot of people think that just because they push the Benadryl into the IV, that's all that they need to do, and nurses will refuse to use a saline flush to push the Benadryl, get it put through the vein, because they believe that you're trying to reach some type of euphoria. Well, newsflash, Benadryl does not cause euphoria. You are not getting high from Benadryl. You can get sleepy, a little bit drowsy, but in terms of you going off having like some LSD, like transit trip, Burning Man type stuff, it's not going to happen. And it does not enhance the so-called high that comes from your pain medications either, especially for patients like ourselves who have been using these medications since before we could walk and talk. But the reason I'm bringing this up is because you see that big scar down on my leg? That scar is from an ulcer that I had last August, and that ulcer was caused by IV Benadryl because I had home health and a gravity IV. Now, that IV was running at 300, okay? So for those of you who don't understand, 300 drops an hour, okay? That's how fast that IV was running. Wait, is it 300 drops an hour or 300 drops a minute? No, an hour. And in a regular IV, so you know that vein was doing its job. The minute that the Benadryl would be pushed, the IV would stop dripping. Just stop. Dead ass. And it would stop for a good 10 to 15 minutes. And that was incredibly problematic. And we're going to discuss why in part 2.